Hi, welcome to Dental Boys YouTube channel. So today we are going to share a implant case. Basically, it's a denture retained implant case जिसमें upper and lower दोनों में implants डाले गए थे and उसके ऊपर denture लगाया गया था. ठीक है? And this case came to Dr. Karan's clinic. So Dr. Karan, आगे बताइए.
So I'll put up the photos and the X-rays for the case. So as Dr. Kunal said, this patient came to me to the clinic. She had upper lower dentures and implants placed to retain those upper lower dentures, and basically she was in tremendous amount of pain with her lower dentures.
Okay.
So I went and checked the patient clinically. So I was not unable to remove the lower dentures. It was stuck in one place.
Okay.
So I asked the patient whether it was what was the issue, what exactly happened. So I asked her, "Do you remove it and clean this every day?" So she told me that since it has been done 6 months ago, I have never been able to remove it and place it
Okay.
back. So basically,
So acrylic denture था जो
normal denture
जो basically removable होता है.
So I'll put the I button link for one of our cases which we
Yes.
uploaded on our channel
Yes,
where
yes,
we have done the implant retained denture, the whole surgery, and the entire result is there in that video.
Yes.
So it is a similar case. 2 implants were placed in the lower arch and 3 implants were placed in the upper arch.
Okay.
And implant retained dentures again. The upper denture was removed. She was removing and cleaning it, but the lower denture she was not able to remove, unfortunately.
Okay.
So it was unclean. So she was saying that she's not able to remove it at all. So even I tried a lot and it was not able to come out easily. So usually we use a device known as a crown remover with which we remove out crowns. So I placed the crown remover after giving her anesthesia under the denture, and I hit it for around 15 minutes, and then it detached from the those implant ball abutments. So actually a removable implant retained removable denture should be very easily removable by the patient.
Yes.
And clean and put it back. That is the reason why it is given for maintaining oral hygiene.
What is your take on this? कि क्यों नहीं निकल रहा था वो?
It got stuck for the audience. It's very simple. It got stuck, and then the doctors didn't. They told her to come after 24 hours. I think they were unable to remove it, and they told her it's all okay. You go.
Okay.
You will be able to remove it after some time, and you will. So they thought it will get loosened when she starts eating.
Okay.
And it will. पर वो निकला ही नहीं कभी. तो 6 महीने से डेंचर मुंह में ही था. And there was all muck and all the food and all lodged. So because of that, and also the implant dentures were placed very not in the right position, due to which the situation which we saw, because she was in tremendous pain, we had to open the flap, and this was the situation. You can see on the top. I'll put the picture.
Okay.
So you can see one implant more than half is exposed. Another implant, almost half of the implant is open in the oral cavity. Now, what is the reason for that? It can be either because the denture never came out properly, or the implants were placed and there was bone loss, due to which this was already the situation.
Yes.
So what happened is, when they tried to fix the denture, the material which is supposed to lock the abutments has flown onto the implant.
Okay.
And locked into that rough surface of the implant, and then it became impossible for them to remove.
Yes.
So luckily we were able to remove it without torturing the patient a lot. Otherwise it becomes a huge torture for the patient. We have to cut it in multiple pieces. And it's a very painful ordeal post-operatively. Luckily for this patient, we were able to remove it peacefully. And then now the question is, after removing such a denture and seeing this implant positions, what are there, which you'll be putting up, now what can you give this to the patient as a solution? That becomes a very important part. So yeah.
So first thing मैं clearly बता देना चाहता हूँ, what is the meaning of half ऊपर आ चुका है या half जो कुछ भी issue अगर ये implant के ऊपर, जैसे डॉक्टर करण ने बोला कि आधे से ज़्यादा bone नहीं था वहाँ पे. So what basically we are trying to say कि if you can see threads around the implant,
we will mark it.
Yeah, we'll mark it on the photograph.
Yeah.
So that is the basic, that is the clear indication कि यहाँ पे bone loss हुआ है, या फिर ये टेक्निकली बच्चों बेसिक जो प्लेसमेंट का टेक्निक जो था वो गलत था,
ट्रॉमेटिक प्लेसमेंट हुआ है.
यस.
एंड दैट इज व्हाई बोन लॉस हुआ है, और इसलिए वो एक्रिलिक फ्लो होके अटक गया वो डेंचर के अंदर, और इसलिए वो निकल नहीं पाया. So now coming to the upper denture was also made on 3 implants. Now unfortunately the implant positions were so forward, so the implants were coming out of the mouth like this. तो वैसे वो इम्प्लांट के ऐसे डेंचर है ना, इम्प्लांट्स वर कमिंग आउट और उस पे उनको उसके ऊपर उन्होंने डेंचर बना के दिया था. सो आंटी का जो मतलब पेशेंट जो था उनका जो माउथ वाज like this, you know, like the teeth were out of
Okay.
the lip line, which is very abnormal for any. And so combined with that, the position of the lower, and it was a whole mess of a situation. So what did we do to? And auntie was in a lot of pain, so she was not ready to undergo a lot of corrective surgery. So what did we do is to get the upper denture back into the normal position onto the jaw. We made holes in certain places to accommodate the wrongly positioned implants, which will show you what I have done.
Okay.
Actually. Wrongly positioned implants, get it into the mouth. Because of that, one side we had to remove a complete tooth which was there on the denture, because there was no space to retain that tooth. So all the implants are protruding out of the denture in the form of holes. Luckily for the other doctors, the patient did not have a very high smile line and lip line, so it was manageable. So that was the situation of the upper. So it was a completely messed up job in upper and lower dentures. Second thing, now for the lower dentures, what did we do? We removed the lower implants, which were half the bone was already gone. So we traumatically extracted those implants. We placed 4 implants in the lower denture for her, and we gave her a fixed teeth on them.
Nice.
Now it has been 1 year. We will be putting up the photos. Our lower teeth are doing very well. The patient is doing very well. She's very happy because she has to not remove. She can maintain it very well. And the case got solved amicably. So both the upper and lower denture, upper and lower teeth she has now, so she can eat properly. And we have accommodated the case, which was a very difficult one to do. But the patient had to undergo a lot of trauma. So we had advised upper implants also, but the patient was in such mental agony and trauma that she didn't undergo the upper implant surgery. So we have kept the denture as it is. Till then, she can at least chew, and whenever she is ready, she can go ahead with the upper implants also.
So my question to you would be कि was it difficult for restoring the lower jaw?
No.
4 implants डालने थे.
No, it was actually, I didn't understand in the first place why 4 implants were not put and given a fixed restoration.
In the very first place.
Yeah,
Okay.
because this was she had good bone. We placed very good, long and good width implants after doing some ridge reshaping. Yes. And I will put up the photos. I'll put sequence of photos of how the soft tissue looks now, how the implants are looking now. You can also see the case on my Instagram page. It is there uploaded. Everything actually turned out to be a very simple case, which was goofed up in the first place for I don't know what reason. So, in conclusion, coming back to what I want to say is this patient got the treatment done because the treating doctor was their relative. And then it was a relative, and they felt that they should get the treatment done over there after consulting with us and all the charges and everything. So what this case shows us, Dr. Kunal, is that the end goal has to be kept in the mind before you start placing the implants in the first place.
Yes.
And just because any doctor or anyone is your relative, that doesn't make them by default a good implantologist. I have seen this a lot. Many people who are watching this video are relatives also, and many people would be dentists. But to do such full arch jobs, you really need someone who knows what he's doing.
Yes,
the positioning of the implant has to be in a way I will show you in the picture again. So you should know how it is positioned, how it looks when it's in the teeth. It cannot be placed like that just because you don't know how to do implantology. So what I want to say is that many people feel that everybody is doing implants nowadays. People feel that सब डॉक्टर सेम इम्प्लांट करते हैं. सब डॉक्टर का इम्प्लांट करने का स्किल सेम है. एवरीबडी इम्प्लांट में क्या है, वो सिर्फ ड्रिल करके डालना होता है. तो सबको यही लगता है कि कोई भी कर सकता है. सो ऑल द जनरल पब्लिक दे फील कि इम्प्लांट डालना या फिर रूट कैनाल प्रोसीजर करना या फिलिंग करना ये कोई भी कर सकता है. मतलब सबका सेम है. मतलब सब लोग डॉक्टर ही है. मतलब सबको रूट कैनाल ट्रीटमेंट करने आता है, सबको इम्प्लांट करने आता है. बराबर से सबको फिलिंग करने आते हैं, रिस्टोरेशन जो आप लोग फिलिंग बोलते हैं हम लोग उसको रिस्टोरेशन बोलते हैं, तो सब पेशेंट को यही लगता है कि ऑल डॉक्टर्स डू इट द सेम, तो इसलिए जो सबसे सस्ता है उसके पास करवा के लेते हैं, क्योंकि ये तो जो बाकी लोग है वो है बस किसी का लोकेशन के वजह से ज़्यादा प्राइस है या किसी का थोड़ा साल ज़्यादा कर लिया तो इसलिए उसका ज़्यादा प्राइस है। ये बहुत बड़ा नोशन है जो जनरल पब्लिक के अंदर हमने नोटिस किया है, बट आई जस्ट वांट टू से बाय मीडियम ऑफ दिस केस एंड अदर केसेस व्हिच वी हैव अपलोडेड दैट ऐसा नहीं है। When someone is telling you a certain quotation for a certain thing and you feel that it is double than what someone has quoted it, there is a reason for it.
Yes.
The armamentarium, the implants used, and the most important thing, the surgical skill of the implantologist. That is the most important, even for doing a root canal treatment. Everybody cannot do the same root canal treatment.
Yes.
रूट कैनाल का आपके खुद के मुंह में 32 दांत है, 32 दांत में 32 तरह का डिफरेंट एनाटॉमी होता है। वो डील करने के लिए बिना आपके दांत को ज़्यादा घिसाए हुए, बिना आपके दांत के स्ट्रक्चर को ज़्यादा निकाले हुए, विदाउट डिस्ट्रॉइंग योर टूथ, टू डू इट वेरी कंजर्वेटिवली सो दैट योर टूथ लास्ट लॉन्ग, इट इज़ अ स्किलफुल जॉब. Everybody cannot do it. Openly I am telling this that everybody's restoration, filling जो बोलते हैं, root canal treatment, denture making, implantology, mostly everything, and every two doctors cannot be doing it the same way. It is not physically possible, it is impossible, and there is a reason why certain doctor charges their fee and certain doctors are not charging what they are charging, because of course if you do such jobs which we showed today, you will not be able to have the confidence to charge, because you are not providing a perfect result to the patient. Not even perfect, this is very way below average. It's horrible, to be very honest. We don't do, we are even in our starting days we have not done, in fact we are more careful.
Yes.
So just because some dentist is your relative, or just because some dentist is very cheaper than some doctor who is quoting, that doesn't mean that they can do the same job that other doctor can do.
Yes, correct.
So that is what, if you want to add, you can add anything.
Nothing much. तो अच्छा है.
So all in all, I would like to say कि please choose your doctor wisely for whatever treatment you do. Don't just listen to corporate clinic charges 500 एक seating scaling और ये और ये. Don't fall for these advertising gimmicks by corporate clinics. Don't fall for. Ask the doctor why they are charging so less or why they are charging what they are charging. Let the doctor give you a proper explanation.
Yes.
Anyone who is charging well and using good equipments and good materials will always be able to justify their charges.
Yes, correct.
And all in all, I would like to say, like, share, and subscribe, and continue to follow our cases. Thank you.
Thank you for watching.
Thank you. Bye.